What does microdosing mean for weight loss medication? Microdosing for weight loss medication refers to using doses below the FDA-approved starting dose. This represents off-label use without clinical validation. Before we go any further, here's something really important. This video does not provide dosing instructions. Do not calculate or change doses on your own. Only your prescriber can provide dosing and titration guidance specific to your situation. If you've heard about people taking a microdose of Zepbound, you might be wondering what that actually means and whether it's something you should consider. Let's break down what microdosing is, why some people try it, and what you need to know to make informed decisions with your healthcare provider. And when people talk about a microdose of Zepbound, they're referring to using doses below the FDA-approved starting dose. And this is considered off-label use, which means it hasn't been clinically validated or studied in formal trials. We'll talk more about what that means in a minute. First, let's talk about what Zepbound actually is. Zepbound is the brand name for tirzepatide, an FDA-approved medication for chronic weight management in adults with obesity or overweight, with weight-related conditions like high blood pressure, type 2 diabetes, or high cholesterol. It's given as a once-weekly injection under the skin. What makes Zepbound unique is how it works. It's a dual agonist, meaning it activates two different receptor systems in your body. It targets both GIP receptors and GLP-1 receptors. The GLP-1 part helps you feel fuller, slows down how quickly your stomach empties, and reduces appetite. And the GIP part enhances insulin secretion and may affect how your body handles fat. Together, these mechanisms help reduce caloric intake and support weight loss. In clinical trials, Zepbound has shown significant results when combined with a reduced calorie diet and increased physical activity. Keep in mind that weight loss timelines vary from person to person, and your experience may differ from what was seen in clinical trials. Now, here's how FDA-approved dosing is supposed to work. The medication starts at a lower dose and is gradually increased under medical supervision. This gradual escalation is designed based on clinical trial data and helps your body adjust to the medication. Your doctor will determine the right dosing schedule for you based on how you respond and tolerate the medication. So why would someone consider microdosing below the FDA-approved starting dose? The main reason people explore this is to try to minimize side effects or improve tolerability. Zepbound can cause gastrointestinal symptoms like nausea, diarrhea, vomiting, and constipation. These side effects tend to be dose-dependent, meaning they can vary with different doses. Some people think starting even lower than the approved dose might make the adjustment easier. Here's the critical thing to understand. Microdosing below the FDA-approved starting dose lacks clinical evidence for both safety and efficacy. The clinical trials that led to FDA approval didn't study these lower doses. That means we don't have data showing whether microdosing actually works for weight management or whether it's truly safer. It might result in suboptimal weight loss, or it could lead to unpredictable side effects. We simply don't know because it hasn't been properly studied. There's another important consideration here. Some off-label approaches may involve compounded products, which carry their own risks, including concerns about quality, potency, and dosing errors. Only use medications and instructions provided directly by your licensed clinician or pharmacist. Never attempt to modify or calculate doses yourself. If you're considering any alternative dosing strategy, this is absolutely something to discuss with your healthcare provider before making any changes. Your doctor can help you weigh the potential risks and benefits based on your individual health situation. They can also establish appropriate monitoring to keep you safe. There are important safety considerations with Zepbound that apply regardless of dose. The medication carries a boxed warning for thyroid C-cell tumors. It's contraindicated in patients with a personal or family history of medullary thyroid carcinoma or a condition called multiple endocrine neoplasia syndrome type 2 or MEN2. Your doctor will screen for these conditions before prescribing Zepbound. If you're taking Zepbound as prescribed by your doctor and experiencing side effects, talk to your healthcare provider. Don't adjust your dose on your own. Your healthcare provider can help you manage side effects through various strategies, which might include adjusting the timing of your injection, modifying your diet, or addressing symptoms with other interventions. They'll also monitor you for any concerning symptoms that might require medical attention. You should contact your doctor if you experience severe or persistent gastrointestinal symptoms, signs of pancreatitis like severe abdominal pain, symptoms of thyroid tumors such as a lump in your neck or difficulty swallowing, or any other concerning symptoms while taking Zepbound. Let's recap the key points. A microdose of Zepbound means using doses below the FDA-approved starting dose. This represents off-label use without clinical validation. The FDA-approved dosing schedule starts low and increases gradually under medical supervision based on clinical trial evidence. If you're considering any dosing strategy different from what's prescribed, have a detailed conversation with your healthcare provider about the risks, benefits, and monitoring you'll need. Remember, this information is educational and not a substitute for personalized medical advice. Do not start, stop, or change medication doses without your prescriber. Always consult with your healthcare professional about your specific situation. What's your experience been with starting a new medication? Drop a comment below. And if you found this helpful, hit that like button and subscribe for more evidence-based health information.